Good morning. Today we are going to discuss some more questions regarding the topic oral cancer. In the first part we discussed some questions and in this remaining questions will be discussed. We will have multiple choice questions. Try to answer these questions and in the next you will see the answer. First question is, what is true about osteonecrosis? What is true among these options? Is it presence of dental or the periodontal disease increase the risk of osteonecrosis? Means post radiation therapy you will see osteoradionecrosis in patients. So is it that the dental or the periodontal disease present will increase the risk of this occurrence? And mandible is most commonly affected. Endarteritis, that is like inflammation in the vessels, blood vessels causes hypovascularity and hypoxia leading within the bone leading to necrosis. So which is true about the osteonecrosis? The answer is all these are the reasons for the occurrence of osteoradionecrosis. Means all these factors will increase the risk. Next question is, in case of mucositis, symptomatic relief is achieved with the use of which drug is useful in case of mucositis? Is it saline rinse is more advisable, or dilute H2O2 is used, or a milk of magnesia? All the above will be helpful in treating these patients with mucositis. The answer is all this will help you to relieve the pain from mucositis to the patient. Next, acute reactions during radiotherapy include which among these are the acute reactions? Means they will see during the radiotherapy only. Immediately after radiation dose, you will see these clinical appearance: hyposalivation, mucositis, or caries. Or all of these are acute reactions only. Which is acute reactions? The answer is mucositis, because hyposalivation occurs after the like not immediately, and also because of hyposalivation and poor oral hygiene, caries also results, but all this will occur later. But immediately there will be mucositis in the patient. Next question is chronic effects. So we discussed acute effect, that is mucositis. Similarly, there are chronic effects of radiation therapy. Or what are the reasons for these chronic effects? Is it due to altered vascular supply or direct damage to the epithelium? Or is it because of fibrosis in the muscles and connective tissues, or all the above? The answer is all these are the reasons for the chronic effects of radiation therapy. Next, hyperbaric oxygen therapy is recommended in cases of where you use this hyperbaric oxygen therapy. In case of osteonecrosis, that is osteoradionecrosis or any osteonecrosis, or to prevent hyposalivation, or to manage pain, or all the above. In each case, you use the hyperbaric oxygen therapy as a treatment modality. The answer is osteonecrosis or osteoradionecrosis. Next question is, acute effects of radiation therapy are due to. So we discussed mucositis is a acute effect of radiation, and even mucositis also occurs as a chronic effect. So what are the reasons for the acute effects of radiation therapy? Is it due to direct tissue toxicity, or hyposalivation, or altered vascular supply to the tissues, or all these are the reasons for the acute effects of radiation therapy? The main reason for the acute effect is direct tissue toxicity. All other these reasons will be causing chronic effects, but direct toxicity to the tissues is the reason for the acute result of radiation therapy. Next question, drug used to prevent occurrence of mucositis in patients receiving chemotherapy or radiotherapy is what is the drug used to prevent mucositis in patients? Cisplatin, or vitamin A supplements are given to the patient, or fluconazole, or amifostine. So what is the drug used to prevent the occurrence of mucositis? The drug is amifostine is used. Just go through this drug mechanism of action, how it is helping in preventing the mucositis. Just go through this topic. Next, drug commonly used to stimulate the residual salivary gland function in head and neck cancer therapy, radiation therapy is. What is the drug that is used to treat? Means that is used to stimulate the salivary glands to produce the saliva, whatever is secretory response is remaining. Okay. So the drug used is pilocarpine, adrenaline, steroids, or all the above. So which drug is used to stimulate the residual salivary flow? The drug is pilocarpine. Okay. Next, speech and mastication are affected, okay, during or after the cancer therapy. What is the reason for it? Why the mastication and also speech is affected in these patients after treating for the cancer? The reason could be is fibrosis of the tissues or surgical removal of a structure in the like oral cavity or hyposalivation or all the above. So what is the reason for the speech and mastication being affected? The reason is all this because there will be fibrosis of the tissues post surgically or surgical removal of the structure, because like for example tip of the tongue is removed, the speech will be affected and also the mastication within the mouth oral cavity will be affected, and even hyposalivation leading to dry mouth also will affect the mastication and the speech to the patient. So all these are the reasons for the speech and mastication being affected. Next question is different methods to maintain dry mouth resulting after radiotherapy are. What are the methods to maintain the dry mouth? The patient will get this dry mouth because of hyposalivation. How will you manage that patient? By giving the drug amifostine, pilocarpine or anethilo, trithione or all these are used. As we discussed, amifostine will decrease the damage to the salivary glands, pilocarpine will stimulate the remaining flow whatever is there in the salivary glands, and also anethylotrithione also will stimulate the salivary glands to secrete the saliva. So all the above is the answer. Next, caries occurring in irradiated patients is typically seen at. Okay, so this typical post-radiation caries occurs at interproximal areas, cuspal tips, gingival thirds, or both cuspal tips and gingival thirds. So what is your answer? Typically it occurs at the gingival thirds and also the cuspal tips, which is very rarely seen otherwise. Next, severity of mucositis occurring post-radiation therapy can be reduced by. So, we discussed severity of mucositis can be reduced in these patients by administering chlorhexidine mouthwash or maintaining good oral hygiene or lidocaine application or all the above. So, which will help you in decreasing the occurrence of mucositis severity. That is, maintaining the good oral hygiene is very important in these patients. Okay, so before radiation therapy, usually they will advise to go with the like oral prophylaxis. Proper oral hygiene should be maintained even after that. Next is candidiasis occurring in irradiated patients is usually managed by. How will you manage these patients with candidiasis? Systemic azoles should be given, or topical antifungals are enough, or salivary substitutes are enough, or maintaining good oral hygiene will prevent the candidiasis. How will you manage these patients? Main mode of treatment is first we have to try to manage it with the topical antifungals. Okay, so if the candidiasis is very severe and acute and causing like erythema and the symptomatic, if patient is symptomatic for a long time, we have to think of systemic azoles. Next, hyposalivation post radiation therapy may cause. So the post radiation you will see some salivary secretion is decreased. So what will it cause? It causes salivary gland swelling, osteoradionecrosis, or is it the reason for the taste impairment in the patients, or all this will result because of hyposalivation. The main affected is taste impairment because osteoradionecrosis because of hypovascularity to the bone, and salivary gland swelling will not occur because of hyposalivation actually. So mainly taste impairment because of less saliva in the mouth. Next, mucositis pain that is caused by mucositis. Pain caused by mucositis in cancer patients is managed by using topical agents which will be given to these patients. Dopixin HCl, doxepin HCl or benzidamine, morphine or all the above. The answer is all these drugs will help you to maintain these patients with pain. Next, caries as we discussed occurring in irradiated patients is managed by. How will you manage these patients? Maintaining good oral hygiene is important, or managing the hyposalivation that is caused by the radiation therapy, or use of fluorides, or all this will help you. All these procedures will be helping to decrease the occurrence of caries in these patients. That is, good oral hygiene should be maintained, and we have to stimulate the saliva whatever is remaining. Secretion of saliva should be encouraged, and also you should use fluorides to prevent the caries. Thank you. Thanks for watching, and keep revising the different topics so that we will be discussing different topics in the form of multiple choice questions. Thank you.